for this presentation. Could I ask Massimo Nicolo from Italy to present his talk, Sub-RPE Neovasculopathy?
Thank you. Thanks to the organization committee for the invitation. So we are all familiar now with this new kind of entity, with this new kind of entity characterized by the presence of vessels growing under the RPE, like in this case. First time those new kind of vessels were described and were thought to be peculiar of central serous choroidal retinopathy. And actually there are several papers that were published on this topic. Actually, I would like to share with you a prospective case series that we selected in Genova in order to understand that maybe these peculiar vessels are not that specific of a central serous choroidal retinopathy, but also of other disease. So we recruited 32 eyes of 30 patients, of eyes in which there are vascularization growing under the RPE. As you can see, 18 eyes were diagnosed as having AMD, 11 CSC, 1 DME, 1 IPCV, and 1 pattern-like dystrophy. At the moment we selected these eyes, 17 eyes had still subretinal fluid, while 18 eyes had no subretinal fluid. What about choroidal thickness evaluation? We didn't find any significant difference in the choroidal thickness between the study eye and the fellow eye of these patients, as well as any significant difference between AMD eyes and CSC eyes. 29 eyes were treated previously with anti-VEGF or half-dose PDT or a combo treatment, and the eyes that received just anti-VEGF, in 47% there was still fluid, in the remaining percent there was no fluid. Eyes that were treated previously with half-dose PDT had fluid in 60% of cases, and there was no fluid, and actually were all CSC in 40% of cases. And then we have two remaining cases that were treated by a combo treatment, anti-VEGF and half-dose PDT, and it was actually a failure because there was still fluid. So we are talking about a case of like this. This is the right eye of a patient that actually we are following for the left eye, in which she has an exuded AMD, and we are treating for that. Right eye is like this, no symptoms, visual acuity of 20/20, but as you can see, there is a subtle RPE detachment, and there is a flow under the RPE detachment. And as you can see, there is an extensive vascularization, which remind me what it was at the beginning of the 90s, described by Iannuzzi during the introduction of indocyanine green angiography as a neovascular plaque. So it's very similar, and basically maybe it's the same. So this is another case, a case of a patient with central serous choroidal retinopathy. There is a huge subretinal detachment, undulated RPE detachment. Sometimes we don't know what to do with these patients. We saw that anti-VEGF might be effectively in treat this patient, sometimes not. We tried to inject this patient, and this is the baseline, and this is what happened after a cycle, a loading phase of anti-VEGF. There was a complete resolution of the fluid, and there was a significant reduction of the vascularization. This is another case, a typical AMD case with the soft drusen. There is fluid, there is undulated and thick RPE detachment with vascularization underneath. So we decided to treat this patient. He responded very well. There was a complete resolution of the fluid and a significant closure of the neovascularization under the RPE. This is another case which we at first can diagnose as a choroidal neovascularization with an occult component, a classic component. We perform OCT. There is an extensive subretinal detachment of the neuroepithelium and undulated RPE detachment. And under the RPE detachment, actually, is growing the choroidal neovascularization that we saw in the fluorescein angiography. So what about the treatment of these patients? I think, and I bet that most of you would have been treating this patient with anti-VEGF. I decided not to treat with anti-VEGF, but I decided to treat with PDT, half-dose PDT, exactly on the choroidal neovascularization. We moved down before doing PDT also in the segmentation line in the choroid, and you see that there is a different level of depth in the choroid. There is a dark pattern, so there is a dilation of the choroidal vessel. So after PDT on the vascularization, there was a complete resolution of the fluid. There was still the choroidal neovascularization over there. It was basically the same, but there was a significant decrease in the choroidal thickness that was shown also by the segmentation line moved down in the choroid, which appear in the different level less dark. So there was a reduction of the choroidal thickness that corresponded to a reduction of the dilation of the choroidal vessels. And this is the follow-up at 3 months. Again, the macula is dry, but the CNV is still there. Choroid is still less dark. And then there is the follow-up more than 1 year after half-dose PDT. The macula is still dry. Another case which this patient actually is asymptomatic because, as you can see, fluid is not in the fovea. The other eye is followed for a disciform scar secondary to AMD. There is the RPE detachment, there is flow, and there is the vascularization. What to do with this patient? We decided not to treat, but to follow this patient. And actually, we were lucky, maybe. There was a spontaneous resolution. And if you see the choroidal thickness, there was also a significant reduction in the choroidal thickness, but neovascularization is almost the same. We followed the patient, and the fluid recurred. The fluid recurred, and the thickness increased again in a significant way. And new vessels were still there. And so on. There was still fluid at the moment. And the last case I want to show you is a very peculiar case that we are following since 2014 when we visit for the first time this 55 years old white female with let's call it a pattern-like dystrophy. There is a alteration of the RPE with a butterfly morphology. You see that the macula is dry, the profile is okay. There is a slight thickening in the right eye of the outer layer. We perform OCT angiography, and in the left eye it was okay, but look at the right eye. There was a huge and extensive vascularization growing in a subtle way under the RPE. So in conclusion, vascularization growing under the RPE is not peculiar of chronic CSC. The pattern of growth is typically horizontally with little subretinal fluid and no hemorrhages. And we still do not know the meaning of this kind of vessels. Should they be considered neovasculins such as treated aggressively with anti-VEGF, or should they be considered as a compensatory response to a reduced capacity of the choroid to bring blood to the outer retinal layer regardless of a choroidal thickness? We still don't know. What we know at the moment is that it is very important to add in our imaging procedure Angiography, otherwise we will miss this kind of lesion. Thank you very much for your attention.